Coronavirus anxiety. Recognizing the impact a pandemic can have on your mental health. The coronavirus pandemic has profoundly disrupted the way in which we live and work, and many of us are feeling understandably stressed, confused, and frightened. All of this is completely normal, said Olivia Fisher, a mental health researcher at Queensland University of Technology. It's important to remember we are human, and most of us haven't dealt with something like this before. Feelings of worry and unease can be expected during a stressful event, but it's important to manage our stress before it turns into more severe anxiety or panic. If you are really overwhelmed or feeling anxious more days than not, that's when you need to be seeking some support. We all respond differently to crisis. In dealing with stress or anxiety related to COVID-19, we are likely to behave a different ways. Some of us might choose to distract ourselves and try to switch off from what's going on, while others will seek constant reassurance from friends or family, or obviously check the news. According to Reach Out, signs of stress can include dips in mood, a lack of motivation, muscle tension, headaches, insomnia, irritability, and stresslessness. But how we respond to stressful situations depends largely on our personal circumstances and personality. Humans are pre-programmed to continuously estimate how likely that something negative is going to happen and how severe that negative event or impact is going to be. People who are uncertain of themselves or lack trust in others or the world because of their background are going to be prone to overestimating the likelihood or severity of danger and take more instant actions. In the context of COVID-19, some anxiety or concern was warranted, especially if it is pushed people to take extra precautions with personal hygiene or physical distancing. It could, however, in some cases, tip over into undue panic and lead to unhelpful behaviors and thoughts. People who have got a tendency towards obsessive compulsive disorder or anxiety disorders, for example, might start having panic attacks. We have seen elements of panic in the community with the stockpiling of toilet paper. Everyone differs in their need for control, their tolerance for uncertainty, and their ability to be resilient. All of these things work together with our sense of threat. Many of us are already feeling the mental health impacts of the pandemic and social distancing measures that seek to contain it. Those of us with existing mental health problems are particularly at risk of distress, as well as those who are socially isolated because of age, disability, or the fact they live alone. We know loneliness and isolation are high risk factors for developing mental health problems. But with many people now facing the prospect of unemployment or financial insecurity, the mental health impact of COVID-19 were likely to be even more widespread, Dr. Fisher said. I think a lot of people have suddenly found themselves in a very vulnerable position, she said. It's the people who have lost their jobs, their purpose, their sense of identity, and sense of belonging in the workplace. When all of that is suddenly taken away, those people can certainly be at high risk of experiencing anxiety and other mental health problems. Looking after your mental health. Beyond Blue has put together tips to help people take care of their mental health during home isolation, but they are relevant for many of us who are simply physically distancing. Remind yourself that this is a temporary period of isolation. Remember that your effort is helping others in community. Stay connected with friends, family and colleagues via email, social media or phone. Engage in healthy activities that you enjoy and relaxing. Keep regular sleep routines and eat healthy foods. Try to maintain physical activities. For those working from home, try to maintain a healthy balance by allocating specific work hours and taking regular breaks. Avoid news and social media if you find it distressing. Stay connected, stay healthy and switch off when you can. Give some of the strategies we normally use to manage our mental health are restricted. It's important to adopt and develop new ways to cope. Research shows positive social support improves our capacity to cope with stress. Staying connected with friends, family and colleagues virtually or over the phone is key, as is prioritizing adequate sleep, regular exercise and activity we find relaxing. When it comes to media consumption, Dr. Fisher said, switching off completely wasn't a realistic expectation for most people, especially given the unfolding nature of COVID-19. It was important to stick to trusted sources like the World Health Organization and minimize the risk. The message echoed by the WHO, who recommends people minimize watching, reading or listening to news that causes to feel anxious or distressed, and instead seek information updates at specific times during the day, once or twice. While stress and sadness are normal and natural response to COVID-19, it was important for people to seek professional help if anxiety or depression symptoms started to interface with their work, relationship, or ability to manage day-to-day tasks. Professor Curious said it was a good idea to check out Head to Health or get in contact with your local GP. Thank you very much.